Assalamu alaikum, it's me. Today I would like to talk about the crying infant. Suppose if you if you observe a patient, if you see a patient with a complaint of he's a 6 weeks old baby, his parents complaining of inconsolable crying. The patient has cried almost continuously up to 4 hours for the past 3 weeks, and the pacifiers and the other things to calm him down is not possible. He breastfeeds every 2 to 4 hours, soft stools 2 to 3 times daily, temperature normal, frontally soft, and in otoscopy examination, what you get is erythematous tympanic membrane that are compliant on insufflation bilaterally. What should be the most appropriate management? So just we get the autoscopic finding. With this autoscopic finding and these the clue about the crying infant, what should be our differential? For normal, if you consider normal, what should be its definition? What should be the normal definition? In normal is intermittent and he can be consolable, and it should be less than 3 hours a day. If it is more than 4 hours, more than 3 hours a day, you have to think that the baby is crying. The crying baby, the crying infant is not normal. So first thing, for considering normal, it should be less than 3 hours and it should be consolable, and it is intermittent. Sometimes in crying infant we have to look for colic. If it is more than 3 hours a day and more than 3 weeks a week, healthy infant age less than 3 months. Usually uh, this baby, as he is unable to speak, so he sometimes shows the colicky pain, or he shows inconsolable crying for more than 3 hours. Usually at the evening time he is unable to consolable, and more than 3 hours a day and more than 3 weeks, more than 3 days a week. If that patterns follow, this is colic. And healthy infant age less than 3 months. So less than 3 months, more than 3 hours a day, and more than 3 days a week. And the next DD should be GERD. In GERD, there is frequent speed up, back arching after feeding, back arching after feeding. These should be the clue you have to look for. And sometimes the infection can cause the incessant crying. These unconsolable crying, one of the thing should be infection. So infection is one of the cause. And in infection, what are the infection we should consider? As we have done the otoscopy, we should look for otitis media. In otitis media, there is bulging tympanic membrane with or without fever. If the baby has fever and neck rigidity and bulging frontally and lethargy, then you should consider meningitis. And if he has limited extremity movement, he is not moving his arms and legs due to pain, then you have to think about septic arthritis, and UTI should be thought. And another thing, the uh, Unconsolable crying infant that is interception, episodic irregularity with legs drawn to abdomen, episodic irritability with legs drawn to abdomen, and there is bilious with or without bilious emesis and bloody stool. And then another DD you should think about torsion. Testicular torsion causes insertion crying. And then another thing, the last DD you should think about trauma. You should think about trauma. Hair tourniquet, wrapped, hair accidentally wrapped around a digit. There may be corneal abrasion, tearing photophobia with fluorescent test positive, and there may be some sort of abuse. So in our case, what we are of what we have find that he has colic as his crying is less than 3 hours or near about 4 hours, usually in the evening, and mostly more than 3 times a week, more than 3 days a week, more than 3 days a week. And the treatment is like soothing technique should be reviewed, and other things, the stimuli, minimizing environmental stimuli. He should be use swings, carriers, strollers for calm him down, allows parents to rest from active soothing, and the soothing techniques should be reviewed, and feeding technique should be reviewed in such a case. So that's all about the crying infant. Hope you enjoyed.